How to treat and cure HIV. HIV is treated using a combination of medicines to fight HIV infection. This is called antiretroviral therapy. ART isn't a cure, but it can control the virus so that you can live a longer, healthier life and reduce the risk of transmitting HIV to others. ART involves taking a combination of HIV medicines every day, exactly as prescribed. These HIV medicines prevent HIV from multiplying, which reduces the amount of HIV in your body. Having less HIV in your body gives your immune system a chance to recover and fight off infections and cancers. Even though there is still some HIV in the body, the immune system is strong enough to fight off infections and cancers. By reducing the amount of HIV in your body, HIV medicines also reduce the risk of transmitting the virus to others. ART is recommended for all people with HIV, regardless of how long they've had the virus or how healthy they are. If left untreated, HIV will attack the immune system and eventually progress to AIDS. HIV drug classes. HIV medicines are grouped into 6 drug classes according to how they fight HIV. The 6 drug classes are Non-nucleoside reverse transcriptase inhibitors, NRTIs. Nucleoside reverse transcriptase inhibitors, NRTIs. Protease inhibitors, PIs. Fusion inhibitors. CCR5 antagonists, CCR5s, also called entry. Integrase strand transfer inhibitors, INSTIs. The 6 drug classes include more than 25 HIV medicines that are approved to treat HIV infection. Some HIV medicines are available in combination, in other words, 2 or more different HIV medicines are combined in one pill. Choosing an HIV regimen. The choice of HIV medicines to include in an HIV regimen depends on a person's individual needs. When choosing an HIV regimen, people with HIV and their healthcare providers consider the following factors. Other diseases or conditions that the person with HIV may have. Possible side effects of HIV medicines. Potential interactions between HIV medicines or between HIV medicines and other medicines the person with HIV is taking. Results of drug resistance testing, and other tests. Drug resistance testing identifies which, if any, HIV medicines won't be effective against a person's HIV. Convenience of the regimen. For example, a regimen that includes 2 or more HIV medicines combined in one pill is convenient to follow. Any issues that can make it difficult to follow an HIV regimen, such as a busy schedule that changes from day to day. Cost of HIV medicines. There are several recommended HIV regimens, but selecting the best regimen for a particular person depends on the factors listed above. Treatment and care. Without treatment, nearly everyone with HIV will get AIDS. These links will give you all the information you need to get the best treatment and care. Treatment. HIV treatment. When people discover they have HIV, they may not begin taking medications immediately. The decision to start treatment for HIV is individual and considers a person's past medical history, the length of time they've been infected with HIV, current CD4 T cell count, and current health. HIV vaccines. 2 main types of HIV vaccines are currently being tested: preventive and therapeutic. Alternative medicine for HIV and AIDS. Antiretroviral therapies have brought renewed hope for many people living with HIV. However, they do not offer a cure, and they can cause many side effects. HIV treatment, coping with side effects. Here are some common side effects of HIV treatment and tips for coping with them. Finding an HIV/AIDS. The HIV/AIDS doctor you choose should be knowledgeable about HIV and have experience treating patients with HIV and AIDS. You'll also want to find a person with whom you feel at ease and can talk comfortably. Expanding HIV and AIDS drug options. Today, HIV-positive people have many options for AIDS and HIV medication. HIV treatment in children. If HIV is diagnosed before it becomes AIDS, medicines can slow or stop the damage to the immune system. Early treatment can help your child live a long and active life. There is no cure for HIV and AIDS yet. However, treatment can control HIV and enable people to live a long and healthy life. If you think you're at risk of HIV, it's important to get tested to find out your HIV status. Testing is the only way to know if you have the virus. If you have already been for a test and your result came back positive, you will be advised to start treatment. Treatment is the best way to stay healthy until there is a cure, but you must take it every day. Cure for HIV. Researchers and scientists are talking more and more about the possibility of a cure. We now know HIV as well as certain cancers. A lot of recent research has focused on finding a functional cure. A functional cure means that HIV still exists in the body but at such low levels it can't be detected by a blood test or make you ill. The most well-known case of a potential functional cure occurred in a man called Timothy Brown, also known as the Berlin patient. Scientists have also tried giving babies born to HIV-positive mothers early treatment to stop HIV hiding in their body and prevent it from spreading. Functional cures are difficult to achieve because HIV hides just out of reach in hidden reservoirs. Destroying the reservoirs may be the key to curing HIV. There has also been lots of research into an HIV vaccine. However, it would only offer partial protection and would need to be used in combination with other treatments.